welcome in to Your Health. And folks, we have a real treat for you. You know, May is Stroke Month, and we have someone absolutely wonderful, something new in town that we've not had before. We're going to talk about what a stroke looks like. We're going to talk about next week how you can prevent that, and the following week we have something wonderful for you. We have a new treatment. So we have with us the only real star in town who does this treatment, Dr. Vamshi Balasetti. And I would like for you to explain to our audience, you're not just a cardiologist, you're something very special. And what exactly do you do?
Yes, Virginia, thank you for having me on your show. Really appreciate it. I'm a vascular and interventional neurologist. So my primary specialty is neurology, and then I subspecialized in vascular and interventional neurology.
Wow.
Yeah.
How long did it take to get out of school with that?
After the medical school, it's a 7-year training program.
Wow. And you have been here in Montgomery since August of last year, is that right?
That's correct.
Okay, and you're at Baptist South.
Mm-hmm. Yeah.
Wonderful, because that is such a fantastic place to go for anything that is related to the heart,
Okay.
in particular. That's the place to go. Mm-hmm. Well, you know, the first thing we want to talk about, since it is Stroke Month, is how do you know when you're having a stroke?
That's a very good question. See, as you know, stroke is a life-changing event. Anything that happens all of a sudden. So that's one of the most important things to understand. It's sudden onset of weakness on one side or the other, or trouble speaking, trouble coming up with the words, or trouble understanding others, and weakness of the face, or loss of vision. Loss of function is what a stroke is all about, and that happens all of a sudden. And there are several acronyms that are out there that help people understand it better. Like the most popular one is the B FAST, where BE stands for B is balance. So any change with your balance or gait imbalance, ICE, loss of vision, or double vision. And then FAST, F stands for face, so weakness on one side of the face, where your face is droopy.
Right.
And arm weakness, where if you have your the person hold up their hands, they drop one of their arms, which is weak. And then
Okay.
S, fast. S stands for speech problems, and T is for the time, so which tells us that it's time sensitive. So the faster you take the patient to the hospital, the better for the patient.
Well, let's say you have maybe one or two symptoms.
Mm-hmm.
You know that something's wrong, but you're not incapacitated.
Mm-hmm.
Let's be sure people know what to do. You don't get in your car and drive to the hospital, I assume.
That is correct. It's very important to understand the time sensitivity attached to this diagnosis, and the outcomes are all dependent on how soon you can get to the right place and get the right treatment. So it's always important to call 911
Okay.
and get the patient transferred that way, rather than putting them in a private vehicle and taking them to the hospital. Private vehicle meaning their own car. I would not suggest you do that. Rather call 911 and take the patient to the hospital.
So rather than, let's say, have your son or your husband or whatever drive you, what is the advantage to calling 911 and getting an ambulance, as opposed to having the person that you live with or your relative take you?
The EMS personnel are very well trained with identifying these patients, and they're also well trained in triaging the patients to the appropriate location. So we may not do the right job in taking the patient to the right place, to the right hospital at the right time, which the EMS folks would do.
Great. So if I have any of those symptoms and I dial 911 and then I get the ambulance and the trained people, they know where to take me. And since time is so important, I think what's interesting to me is that if you're in that ambulance, those people are trained to do what needs to be done between the time they get you and the time they would get me to you.
Absolutely.
As
Correct.
whereas a husband or a son or a daughter wouldn't know.
That is correct. And usually when the EMS is called in and they've seen the patient, they are already calling the hospital, the ER, and making them aware of that patient with these specific symptoms coming in. So we are already prepared to accept that patient and ready for the patient.
Wow, I think that's good to know, because I know a lot of people whose first instinct would be to, especially a husband and wife, would be to take your mate, put them in the car and drive them.
Right.
And folks, don't do that. That is not the right thing to do. And it's always good to have a doctor explain why that's not the right thing to do. So basically that lets us know what a stroke looks like and what we need to do if we feel that we're having any of those symptoms. And even if it's just one or two, we shouldn't ignore those, right? We should.
That is correct. Even if, I mean, you don't have to have all the symptoms in that acronym. You may have more than that or less than that, but anything that happens all of a sudden and that's concerning for a stroke, I would go to a hospital right away.
Okay, thank you so much. And folks, thank you for being with us for this segment. And we've got a lot more to teach you, because your health is so important and time is of the essence. And Dr. Balasetti, thank you so much for being with us.
You're very welcome.
And
Thank you.
we'll be right back.